Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. Waiting on some people to join us. So good. I'm hoping you're having a good Saturday today. Sunday. Today is Sunday. So if you want to share the screen, just press the button at the bottom of the screen. Sharing is caring. And if you have a friend that you want to hear this message, please tag them. Okay. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're in the right place. So today we're going to continue our talk on procedures, and today we're going to talk about dermal fillers. As you recall yesterday, I talked about the locations where you can inject fillers. Like I stated, the forehead, the glabella area here, the nasolabial fold, which is this area here, the commissures, the oral commissures, for people who have a downward turn on their sides of the mouth and they keep getting infections, as well as the marionette lines, which are here, and also you can put it in the dorsal hands and any areas of scarring. And my favorite area is the cheeks. So anyways, let's just talk about some fillers. We're going to let's talk about the fillers that are made from hyaluronic acid. So hyaluronic acid, as you know, is something that is normally found in our body. So that's the beauty of these newer fillers, unlike fillers that were made years ago. The newer fillers, yes, they're man-made, but they're made with products that mimic what we normally make in our body. So therefore, you don't really have to test them to make sure a person is not allergic to them or have a reaction to it. And it is processed by our body, so it's more of a natural appearance, as well as your body breaks it down better. So these fillers that are on the market nowadays are very safe, and they do a really good job. So as far as hyaluronic acid fillers, you're looking at Bellaterra. There is Juvederm filler. There is Voluma, which is again another Juvederm product made by Allergan. There is the Restylane as well as Prolong. And so Pristine. But regardless, your Restylane products is not cross-linked. So the hyaluronic acid is a very small molecule, and when you inject it, it is really good around the lips area, and you can use it in the forehead too, but mainly around the lips. And because it's a small molecule, it does not last long. So the product actually breaks down faster. Now, they would tell you that it lasts about 6 months, but really, in fact, it actually lasts about 3 months. So just keep that in mind. But it's a really good product for around the lips. Now, let's talk about, first of all, where we inject these fillers. So we call them dermal fillers because we inject it into the dermis. But there are one filler that you actually inject underneath the dermis, subdermal area, and that's called the Voluma. But all the other fillers we inject in the dermal area. Okay, so that's why we call it dermal fillers. But regardless, getting back to what I was mentioning, the Restylane filler is a lightweight, very small molecule composed of hyaluronic acid, and therefore it does not stay around a long time. But it's really good for the areas around the lip, because if you go with a really thick filler in the lip, because we move that area so much, the fillers can bead up and cause more thickening and unwanted results than what your goals are. So the next group is your Juvederm filler, which will say they last about a year, give or take 6 to 9 months, really. And again, it depends on the person. When we talk about hyaluronic acid products, your body breaks it down. So some people break it down faster than others. And that's why majority of people do not get that longevity. But some will get that year longevity, but the majority are getting 6 to 9 months. And with Juvederm, they have the lower weight molecular weight product. Therefore, you can inject it in the lips. It doesn't last as long, again, 3 to 6 months. But the one that is cross-linked, your Juvederm, it lasts much longer, up to a year. And that one you can inject in the lips, but you can also inject in other areas such as your nasolabial fold, lower eyelids, and of course, forehead area, as well as well as glabellar area. So then there's the Bellaterra, which is made by the same company who makes Radius. But Bellaterra is a hyaluronic acid molecule, and that molecule it lasts a long time, but it's really good for the nasolabial fold and the cheek area. And then there is also Voluma, which is injected deeper than your other hyaluronic acid containing products or dermal fillers. And with that, you see it lasts longer. So of all those fillers that are hyaluronic acid, the one that's on the lips, which is your Restylane, the Juvederm, which is good for the lips as well as the cheeks and the glabella area, and then your Bellaterra. Bellaterra lasts up to a year, and your Voluma lasts longer. It states 2 years, but we're seeing really a year to year and year and a half is what you're looking at, a year and a half, because it's a bigger molecular weight molecule, so it's a bigger molecule, and it's placed deeper in the skin. So you really get some good results there. But again, it lasts longer than the other previously mentioned hyaluronic acid containing dermal fillers. So there's 2 other fillers that are not hyaluronic acid containing fillers. And the beauty of these fillers is it causes your body to make collagen. One is Sculptra. Sculptra has been around a while, and it actually has the indication to help people who have HIV, who have lost the fat, we call it lipodystrophy, in their cheeks. It does a really good job, and like I said, it has FDA approval to be used to replace that. And so they have that sunkenness and depression of their cheeks, cheek area, and sure enough, once you inject it, it's made with poly-L lactic acid. It does not show up immediately, unlike hyaluronic acid containing products or the Radius. It takes a couple of months before you see it, almost 3 to 6 months, but it lasts 2 years. So it's, again, a good product for dermal fillers. It's just that you don't get that immediate result. But when you do get the result, it lasts a long time, up to 2 years. So and another class is called your Radius, which is actually made of calcium hydroxyapatite particles, which is mimic like your bone. And when you inject it, it's like putty, but you see it results immediately, but it does last a year to a year and a half. And after 2 weeks, it solidifies, so you cannot move it. But that with Sculptra actually causes your body to make more collagen. So that's why it lasts so long. So it really does a good job of doing that. And again, it does not break down as fast. So therefore, like I said, it does last longer. And those products are really good for your cheeks, as well as the Voluma. Voluma, Sculptra, as well as Radius are good for the cheek area. It's good for the nasolabial folds because it's a thicker product, a bigger molecular weight product, and it lasts longer. So fillers are really nice. They're here to stay. So if you don't want to have the surgeries performed to tighten the skin, you don't want to do that. Really the fillers has its place. Not only to, in a sense, to help ward off surgery. And I say that because some people just don't want the surgery done. But even if you have surgery, fillers are still a good option too, along with surgery, because it fills in areas of volume. So wherever you have a loss, and a lot of times you don't appreciate the loss until you go back and look at a picture of yourself when you were 20 or 30 years old, and you'll see how much you've lost. You see you've lost a lot of the cheek area. Again, you can see that line, depressed line on the nasolabial fold area, which is in here, like I stated earlier. As you're talking, you notice you got indentation in here, your marionette lines. And not to mention the hands, you don't see that around your 40 and 50, but man, when you get to 60s or 70s, you see your blood vessels, you see the sunken skin on your hands. Fillers are really good for that. And like for the hands, I actually use Radius for that. But you have a lot of different options as far as where to put fillers. You just need to know sometimes thicker is not better. So you don't want a thicker filler or heavier weight molecule filler on your lips. Keyword, that's not an option. So That's when you would get the finer fillers that are lower molecular weight, such as your Radius and such as your Restylane, and or Juvederm. They have a Juvederm regular, and then there's a Juvederm Ultra Plus. So you can use Juvederm, which is good, a thicker filler that is good for the lips, but it's not too thick. So just keep that in mind. Higher molecular weight that lasts a long time is not always good for fine, delicate areas such as the lips or around the eyes. So, and even in the lower eyelids, you can put fillers there to hide the discoloration that you see from that blood vessel, prominent blood vessel that is more obvious now because you have loss of collagen. So again, just be really careful with what choice of filler that is injected in certain areas of your face. But the outcomes are really nice. And I like it because nobody really know what happened. They just know you look different and you look good. So that was some options for you. And for people who just don't want to get stuck at all, if you don't want any injections, got a good product for you, our Wrinkle Free Serum, which is at GRxSystem.com. You can go right directly to the website. Or if you want a free gift, you can go on over to GorgeousSkinNow.com to get free gifts. But regardless, you will all end up at the same spot. And the product that is really good for people who do not want the injections, but want the effects of a filler, and to a certain degree. Of course, when you're injecting something, it's going to be a better outcome than something you rub on any day. But definitely, you can get some improvement with Wrinkle Free Serum, and that's what we sell on in our system, GorgeousRx products. So definitely, if you're interested, go to GorgeousRx.com, or if you want free gifts, go to GorgeousSkinNow.com or .com rather. And again, any questions? Well, hello, ladies. Thank you for joining me, and some doctors. I appreciate your support. Okay, so I'm glad you caught me. Unfortunately, I'm running a little late giving this talk, so it's a Sunday. But anyways, I'm trying to see if anybody have any questions. Thank you, and please share. I appreciate your support, and thank you all for listening. Tomorrow we're going to talk about, not for sure, but it's going to be a good topic nevertheless. Anyways, have a wonderful day. And again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. Again, go to GorgeousSkinNow.com for your free gifts, as well as to consider looking into that Wrinkle Free Serum. Take care. Have a wonderful day. Bye-bye.